recording. Okay, so for us, this is week 8. This is the last week of content, right? Because next week you have an exam, your exam 3, right? So last week, we covered 6 and 7, week 6 and 7, and we'll go through 8 today. We'll do a lot of it with the quiz because the quiz has a lot of a variety of questions. And then I forgot to send the case study to you in the announcement over the weekend. So I put the case study that we're going to do towards the end of class in your announcements about a half an hour ago. So just somebody in the group will need to pull that up. Or the more people that can pull it up, the better. And we'll break out into breakout rooms towards the end of class and do that case study. Same as we've done the last couple of case studies. Okay. Exam 3 study guide, you have that, correct? Everybody has exam 3 study guide. I'm going to repost when I send the recording for this class. I will repost the can anybody pull that up from week 1? I guess I could. Hang on 1 second. Let's see. Review schedule. Hang on 1 sec. Does anybody have the current review schedule? Anybody have that pulled up? I don't have it memorized all the dates this week. I know it was sent in week 1 and I tried to resend it this. Let me see if I can open that in this announcement. Hang on. It was in the week 8 announcement and information. Let's see.
You're looking for just the times and dates of each?
Yeah, I have it right here.
Okay.
So you have one. Let me share my screen here. Okay, can everybody see that? So if you need to write these down, exam 3, there's one tomorrow at 6 p.m. with Professor Price. There's one tonight at 6 p.m. with Professor Alani. Let's see. There's one, today's Wednesday, so Friday, the 31st, in the afternoon, 1 p.m. Eastern with Professor Johnson. And then it looks like Saturday morning with Professor Lundy at 11 a.m. Eastern. Everybody seeing this? And then Sunday evening with Professor Kershaw. So you have 5 reviews, 5 opportunities. Looks like one tonight, one tomorrow, one Friday, one Saturday, one Sunday. So you have one every day. Every day starting today. Okay. KCN and Shakithia, can you come on camera, please? And I have a couple of other housekeeping, but review sessions, review schedule. Okay. So why don't KCN, you there? Shakithia, you there? There you are. Okay. Just waiting for you guys to come on so that we can start the quiz. There you go. Hi, Shakithia. Casey, you there? So the quiz, 15 minutes, same as the last quizzes. Rationales are in there. We'll review all that when we review the quiz. And the access code is my last name, Marvel, Marvel. Okay. So why don't you go ahead? Is everybody ready to get started with the quiz? Okay. Why don't we go ahead and do that? And then it is 1:05, so we'll go to about 1:25. Okay. Then we'll come back and we'll review the quiz, do some content review, and then we'll do our class case study activity. How does that sound? Does anybody have any questions? Okay. All right, we'll go ahead and start the quiz. Hey, it looks like everybody's done. So if you guys could come back on. How'd we do? There was a lot of content in this week. Okay, we'll just wait for the other few students to come back on before we get started. Kenya, I can't see you. There you are. And I just sent the review schedule and your announcement. So you have that. Okay.
Is there like a PowerPoint for exam 3? Like a PowerPoint, or it's like just like kind of like a page that goes through like the bullets?
For the exam? Yeah, you have your exam 3 study guide. I sent that last week, I think. Right? Everybody should have their exam 3 study guide. I already, yeah, a couple of students are shaking their head yes. You guys have that, right? Okay. I think that might have been sent in the week 7 announcement. Skylar? Think that's when it was?
I
So
can't remember
Ivana,
what week, but I think it was in an email.
yeah, it was in an announcement. Yeah. Yeah. Ivana, double check that. You should have it. Okay. Fantastic. Okay, Tamika, are you there? There you are. Shakita, you there? Okay. I'll share my screen and the quiz covers lots of different content, so I'm gonna try and accomplish both, review the quiz and cover what we need to know, what the important parts of each. Week 7 at the bottom, Ivana. Okay, awesome. All right, fantastic. Thank you, Genesis. Appreciate that. Okay. All righty. Okay, so let's roll. Let's get this. Whoops. Need to share. Did you guys get the rationales as well? Fantastic. Okay. Can everybody see my screen? Yes? Nope? All right, thanks. Okay. So the first question is about case management. Okay. Before we even answer the question, what did you learn about case management? What does a case manager do? What's case management? I mean, in every big organization, and actually small organizations, well, you have what we call case managers. What do they do?
Manage researches and stuff.
Pardon me?
Manage researches, control expenses.
Mm-hmm. It's part of what they do. Yeah. They're managing cases, right? Case manager manages the care. We call case managers coordinators of care. Okay, so as a school nurse, I was considered also a case manager with the complex kids we had in the school. Right? Case manager is the coordinator of services, coordinator of care. Okay, it's an advocate. You're an advocate for the client. Right? So if I had a very complex student in school, I was case managing with the teachers, the administrators. I was coordinating with PT, OT, speech, they had equipment, making sure their equipment. Okay, so think of case manager in the hospital in the clinical setting. Let's say you're discharging a patient. Okay, and that patient needs at-home follow-up, whether it's equipment, whether it's services to come in, whether it's medication refills, whether it's insurance issues, doctors, coordinating with doctors. Case manager coordinates all that care. Okay. Which of the following are the primary goals of case management? So we know that the first three are right. To ensure that care coordination occurs across the continuum. Okay, that could be case management in the inpatient setting. That could be case management from the inpatient setting transitioning to home. There are case managers in every setting. Maybe you're a case manager for clients that have had cardiac surgery. Okay, and you're planning for them to go home. Do they have cardiac rehab appointments set up? Do they have doctor's appointments set up? Does the insurance cover all of the services that they'll need? All right, so that's the care coordination. Okay, to emphasize evidence-based clinical decision-making. What does evidence-based clinical decision-making mean? What does that mean? What's evidence-based practice?
It's backed up by clinical studies
Mhm.
that are done.
Right? So they're basing the case manager is basing their decisions for the coordination of care on evidence-based practice, best practices, correct? That's what evidence-based practice is. And as somebody else just said, manage resource use and control expenses. Case manager, by having one person that can centrally be coordinating all the care, right? That particular case manager can manage and control the expenses. Okay. Has anybody ever worked with a case manager or been approached by a case manager for information or patient information with regards to a plan of care? Anybody ever worked with a case manager? What do you see their role as? What were they doing when you worked with a case manager?
They coordinate hospice care for comfort measures patients when they're coming in from hospice. They coordinate the ambulatory services when the patient's being discharged from the emergency room.
Yeah.
They figure out if the patient needs a wheelchair, if they need a walker, if they need an oxygen tank. They figure out if the patient is ambulatory to qualify for those services.
Mm-hmm.
That nature. They find out if the patient has family.
Yeah.
If the patient is a trauma patient, they figure out who the family members are and they're in charge of contacting them.
Yeah. Yeah. That's all what Genesis, excellent Genesis. Thank you very much. It's the coordination of care. What are the patient's needs going to be and how are we going to meet them? Okay. So we're into the rationale now. We're an advocate for the client and the family. Right? We're trying to promote self-determination. Right? We're trying to promote autonomy. Okay. So nurse case managers, we work to meet the health and well-being of the clients through coordination of care. Right? We may be coordinating, like Genesis said, we may be coordinating with nurses, physicians, physical therapists, maybe dietitians. Right? We're providing education and support to the clients. Okay, so it's a big team. There may be a big team involved in the client's care, and that case manager spearheads all of that planning. Okay. Okay, a Spanish-speaking family comes to the public health department. No one in the family speaks English. Nobody in the department speaks Spanish. Which of the following actions should be taken by the nurse? Well, first and foremost, the best solution is an interpreter. Why is that?
No miscommunication or biases.
Exactly. It's part of it. Right? So it's fine to have family members that may speak some of the language, but sometimes it's hard to assess how much they understand and how much they can comprehend. Right?
It-
So, go ahead.
It's also because of the medical terminology, right?
Exactly. Exactly. So an interpreter is actually the best case scenario, right? So here in the rationale, while both the interpreter and the translator interpret and translate information from one language to another, there's this significant difference. What's the difference between an interpreter and a translator? So the translator usually focuses on the written documents, maybe medical records, legal documents, where the interpreter is the verbal communication, right? Trying to help the family understand maybe what the diagnosis is, what the treatment plan is, what the follow-up is. Okay? Obviously, we want the patient to understand all their instructions. What are some other ways? This is just a question for you guys. What are some other ways that you can communicate in the client's primary language?
In the hospital, I had a patient with that he just like only spoke Spanish, but he had a box that would translate
Okay.
what we said to him.
Okay. That's one way. Yep. What are some other ideas? What about pamphlets? What about health information in the client's primary language? I know in the schools when we had to provide information about immunizations to families of a variety of cultures, we had that information printed out in a half a dozen different languages. Okay. Another case management question. Nurses using case management to plan to maximize the patient care outcomes. Which of the following describes an important consideration that should be made by the nurse? Well, B is the correct answer. We know that case management is focused on the individual client. Okay. Yes, we do include the families if they are part of that plan of care, but the initial case management planning is what the client's needs are. And then we bring in whoever is going to be part of that healthcare follow-up team, whether it's doctors, services, PT, OT, family members, caregivers, pharmacists, insurance company. Okay. Disaster. Let's talk about disaster management. Before we answer this question, what did you learn about disaster management? There's two kinds of disasters. Which are they? What are they?
Natural and man-made.
Okay, what are some examples of natural disasters?
Hurricane.
Okay,
Earthquakes,
earthquakes.
tsunamis,
Yep. What about a man-made? What are some examples
Fire.
of a man-made disaster?
Fire.
Fire,
Chemical spills,
spills,
explosion,
explosions, water contamination. So nurses, as community nurses, we need to be prepared to be involved in all phases of disaster management, from preparation to the actual disaster to post-disaster. we're expected to be able to function in any one of those roles. Okay, so the answer to the question, when does the disaster management begin? Right? We begin before it occurs because that's the preparation phase. Okay, that's when the teaching occurs. The teaching or the preparation, that primary prevention. What can we do to help families prepare? Okay, so nurses, we have skills that enable us to work in all aspects of the disaster. Assessment, think of your ADPI. The assessment phase, priority setting, who do we need to collaborate with? Health education, screening, disease screening. Has anybody ever participated in a mass casualty exercise? What are those? What are mass casualty exercises? And what's the purpose of them?
Like to help prepare in case it actually happens, to make sure you know what to do and have everything you need.
Right? The other purpose is response time. How did everybody respond? How did everybody coordinate together? Okay. There's a federal agency. It's called the NRF, the National Response Framework. Okay. While FEMA is the larger federal agency that is responsible for coming and assessing, there is a response framework, national response framework. I want you to remember this, okay? They provide specific needs to a community, okay? And there's 5 things that they provide. Okay, transportation. Take these notes down. Transportation, temporary housing, medical resources, search and rescue, and firefighting. Okay, nurses, we play a really important role in disaster management. Okay, we also have the ability to provide essential public health services, make referrals, serve as liaisons. We also serve as social care providers, maybe providing physical and psychological first aid, triage, your red tags, your green tags, your yellow tags. We need to be prepared to be in that phase of the disaster as well. Okay. Okay, covered all that. A nurse attends a conference to learn more about public health surveillance. Why is it important for the nurse to be knowledgeable about this? Why is it? I mean, aside from the question right now, why is it important, the role we play in public health surveillance? What is public health surveillance? What are we surveilling? What kinds of things are we looking for to surveil?
The types of people that come in with like a certain ailment or something.
Outbreaks? Outbreaks of COVID. Outbreaks of pertussis. Outbreaks of influenza A. Nurses in the community play a large role in surveillance. There was a huge role for the school nurse. We were surveilling what was going on in the schools. Was it an outbreak of chickenpox or strep or pertussis? Okay, nurses play a very important role in the community with regards to surveillance, right? Because here's the correct answer, because nurses are often the first to recognize and respond to a problem, right? Nurses are often the forefront, I mean, the rationale now, the forefront of responses to be made in the surveillance process. Doesn't matter if we're working in a rural or urban agency, whether we're working out in the community with the health department, whether we're working in the schools, working in urgent care, maybe doing telephone triaging. Okay. Okay, the nurse checks the health department records to compare the number of new teen clients presenting for birth control counseling and management in the 2 months before and after the education intervention program to decrease teen pregnancy. Which of the following steps of of the evaluation process is being completed? So if you look at the question, we're starting this 2 months before, and then we're evaluating 2 months after. What are we doing? What part of the evaluation process is this? We're gathering data, right? We're gathering evidence. That's the phase that we're in of the evaluation process. And evaluation is extremely important when we're planning programs, right? So the 6 steps that are identified as part of the evaluation process. Okay, let's review these. Engage the stakeholders. What does that mean? We need to include everybody who needs a seat at the table. Who's going to be affected by the program? Who's going to be using the program? Who's going to be financially supporting the program? Okay, the description of the program. What's the needs assessment that we did? Right? What are the expected effects, activities, resources that we're going to need? Okay. Focusing on the evaluation design, gathering credible evidence, which is what the answer was, justify your conclusions. And then what did we learn? Was it a successful program? Evaluation is the most important piece of program development in the community. As for me in school nursing, evaluation was the most important part of whatever programs I was implementing in the school or teaching about in the school. And evaluation, you are going to be at on your next exam. There are questions about this process, the evaluation process, and how important it is. Okay, continuous quality improvement, CQI, versus quality assurance. What's the big difference? Okay, we know the quality assurance focuses on the client, where continuous quality improvement focuses on the process or the issues. So let's take an example. Let's say we're in a hospital. Let's say there's been an accident. Let's say there was an unexpected death in the OR. Okay, somebody is going to come in and investigate that, right? From that, you're going to be formulating continuous quality improvement changes. Let's say it was whatever the issue was. Continuous quality improvement addresses that as a system. Where quality assurance is patient focused. We all hear about quality assurance in our workplaces, do we not? Yes? No? Okay, why are you guys so quiet today? I don't want to do all the talking. I really don't. Which of the following should be the focus of programming in the community related to communicable diseases proposed by Healthy People 2030? This is on page 36, your rationale. Okay. The correct answer is providing information about hazards of multiple sex partners. Right? This is in that Healthy People box, I think in chapter 1 or chapter 2. Okay, so when we review Healthy People 2030, we know that one of the primary emphases is on the prevention of issues for the public or the population of your community. Which of the following is a common factor typically found in those who abuse others? What did you learn about this topic, this concept when you read about it? It's very common for there to be previous events, previous encounters of violent behavior. That's the most common. Okay, it's not that the other three are not correct, but C is the most common. Do you guys go back and read these rationales after you take the quizzes? Okay. Which of the following best explains why chlamydia is a major focus on public health efforts? Did anybody get this question wrong? Everybody got it right? The biggest concern is the problems that it potentially causes for infants born to moms who are infected with chlamydia. Did you all know that? Okay. Okay. Questions about any of that? I want to go through, I covered disaster, we covered case management through the quiz, but there were a few other topics that I wanted to address. Quality and safety. Okay, we talked about continuous quality improvement. I want to talk about the tracer method. This is one of the ways we manage quality and safety. It's called the tracer method. Okay, it focuses on outcomes of care. Okay, the most important thing when you're using the model of the tracer method is everybody. So think about how we are evaluating the clients. If we're using the tracer method, everybody has to have the same disease. They have to be at the same stage of illness, have a similar lifestyle, similar interventions, and they have to live in the same community. You're going to be asked about this. So we need to know what the tracer method is. What highlights the tracer method from other methods of surveillance? Okay. Ethics. Let's talk about ethics. I know we talked about this in previous weeks, but what is ethics? What is ethics and why is it so important in our profession? Well, actually in our daily lives. What is ethics? What is ethics all about?
Trying to do what you perceive as good
Mhm,
or beneficial to others.
mhm. Who else? I don't want to have to start calling on people. I really don't. Pardon me?
Integrity.
What else?
Integrity.
Integrity. Okay. What else is ethics about?
Like equal opportunity.
Okay. Ivana, are you there? Genesis, are you there? Casey, any of you there? Can't see any of you. Equal opportunity. We face ethical decisions every day of our lives, whether it's in the work setting, the school setting, family setting, out in the community. Do we not? All the time, we are having to make decisions. What are some of the ethical principles? What is the principle of beneficence? What's the ethical principle of beneficence?
Is that like the patient's best interest?
Do good. Beneficence means we do good. What's the ethical?
But my laptop is saying that the internet is unstable, but I don't know why it's not. Is it showing like I'm not on Zoom? Because it's not letting me click anything.
No, it's showing you're not on Zoom, but you can hang out there. You can hang out with Mariana.
Okay, you could just stay here with me.
Yeah,
Okay,
That's
I'm
fine.
gonna try logging on my phone.
if you want, that's fine. Okay. What
Thank
about
you.
the principle of non-malfeasance? What's that? You need to know your ethical principles for the next exam. What's the principle of non-malfeasance?
Do no harm.
Do no harm. So give me an example of do no harm.
Like holding medication due to like adverse reactions?
Mhm. Or maybe holding medication because the caregiver wants to get some sleep. Or maybe cathing somebody and you accidentally contaminate the sterile field. So you need
Or
to go
like-
get you need to go get a new kit.
Or like if somebody were to fall and you don't help them up in the hospital setting.
Exactly. Exactly. What is the ethical principle of distributive justice?
Isn't that treating each individual equally?
That everybody, whatever your pool of resources are, everybody should have equal opportunity to access those resources. And what's your principle of your ethical principle of autonomy? What is that? What's autonomy?
Like the right to make a choice for their own self.
Exactly, Skylar. Those are the 4 principles you need to be aware of. Beneficence, non-malfeasance, distributive justice, and autonomy. Those all guide our practice. Right? Do good, do no harm, equal access. Encouraging and including the patient in the decision-making of whatever the plan of care is. Let's talk about culture for a minute. Let's talk about cultural competence. What is cultural competence? What's cultural competence?
Being open-minded when you're talking to an individual and not forcing your own belief on them.
Okay. Excellent. That's part of it.
Like some people don't want to be touched or eye contact or like male or female providers for the patient.
Mhm. Part of cultural competence is having the cultural knowledge of different cultures, right? The cultural desire to learn about other cultures. All cultures have their different beliefs, values, attitudes, and practices. That has to be incorporated into the plan of care as much as possible. Okay, so when you're coming up with a plan for the client in hospital or going home, all those cultural influences need to be taken into account. Food preferences, medication preferences. What else? What other preferences might we have to take into account? Language preferences. Visitor, caretaker. Everybody, all cultures have different preferences. So in order to be culturally competent, cultural competence is something in nursing that we're working on across our whole career. I've been in nursing over 40 years now, and I think I'm pretty culturally competent, but I'm still learning. It's something we learn about years and years. It's just ongoing. You know, when I was in the schools, it seemed like every September when we started school, because we covered lots of schools, there was always a new population or a pocket of a population in one of my schools that was a new culture from last year or the year before. So what do? How do you become culturally competent? You study, you research, and you ask. Right? Clients are always willing to share information about their culture and what their preferences, their attitudes, their beliefs. Okay? Some of the other cultural differences. Do they want to be touched during a conversation? Like, hey, how you doing? Put your hand on their shoulder. Eye contact. There are some cultures that don't want any eye contact. There are other cultures that want people in the room. You know, that maybe a doctor wouldn't be comfortable speaking about whatever. But certain cultures, especially the Native American, they like to have all the family members in the room listening to everything. What about distance, the physical distance between your client and you? Okay. What happens when there are misunderstandings? What do? Let's say you're a nurse working with a culture that's new to you, you're learning, but there's misunderstandings or there's miscommunications. What do? Is any of you so quiet? Has anybody worked with different clients of different cultures?
You try to be like knowledgeable about the
Right.
culture, like do your research on it. So that way, like beforehand, dealing
Right.
with them, you kind of already know like what are the do's and don'ts.
Right. And it's perfectly okay to say you're not completely familiar with your culture. Can you help educate me? Right? Cultural competence it's critical. It's critical to our profession. In this diverse world, in this diverse country, you, wherever you work, are going to be working with clients of lots of different cultures. What would you do if there's a misunderstanding? Maybe you said a word that wasn't appropriate, or you food service served a meal that might not have met their cultural needs. What do? Because there are going to be miscommunications. There is going to be conflict.
You apologize
You apologize.
You apologize. And you
and like try
learn.
to make it better.
Exactly. I mean, does anybody have any experiences with different cultures that you want to share? I'd love to hear your examples of working with different cultures.
Well, in the hospital that I work at, there's like certain cultures where they only like to be tasked by males. Like if they're a male, they don't want like a woman doing their
Mhm.
ultrasound or stuff like that. Other than that, not really.
Okay. Anybody else work with families or clients from different cultures? Nobody. Okay. Okay, well, you know what? Let's go ahead and do the case study. Does anybody have any questions about all the topics? We covered disaster management, surveillance and outbreaks. We talked about quality, ethics, culture. We talked about case management. So I think we covered everything. Why don't you guys go ahead and pull up the case study? It's a cultural competence case study. I'm going to break you out into breakout rooms. We'll do that. Room 1 will have question 1, room 2 will have question 2, room 3 will have question 3. Then we'll come back and talk about it. Okay? Does everybody see the announcement I sent with the case study? Okay, fantastic.
Read.
Hello.
Hi.
Hi.
Did you guys figure it out?
Yes,
I
ma'am.
think so.
Yes, ma'am.
How's your group coming?
Good.
Did you come up with your answers already?
Yeah, we have it.
Okay, fantastic. You guys all done? Come up with the answers to your question? Okay, fantastic. Okay. Was that a helpful case study with regarding culture? I have some rationales we'll talk about here. I'm going to go ahead and share my screen. Everybody see my screen? Okay.
Yes.
Before we talk about the case study, a couple things I want to ask you. I really appreciate your participation. How do you think culture affects our nursing practice?
A lot, because a lot of our practice is patient-based practice.
Mhm. What else?
Everyone's unique and you kind of have to take a different approach when you are dealing with each patient.
Okay. It's very true. What else?
It's important to know like what's appropriate and what's not appropriate for certain patients.
Okay, let's talk about question 2. What are some methods that we can use for developing our cultural competence to meet the healthcare needs of our culturally diverse clients? Not only clients, but whether they're individuals, if you're in the community, your culturally diverse community, if you're in an organization that's culturally diverse, your organization. How do you develop cultural competence in these different settings or with these different populations?
Doing a lot of research and
Research is-
also asking about different cultures that you see, like how to properly treat them.
Mhm. Anybody else? How would you conduct a cultural assessment? What would you do? From a culture that's different than yours, how would you do your assessment?
You have to ask the patient what are their likes and dislikes before you can proceed, because you don't know if they like to be touched or which staff member they would want, like which if it's a male or a female. So you kind of have to assess that.
Okay. Anybody else? Last question I have is, what are some barriers? We talked a lot about what it means to develop cultural competence. What are some barriers? Nurse barriers, client barriers. What are some nurse
Client barriers.
barriers?
Being closed-minded,
Excellent. Yeah, what
not
else?
being teachable,
Pardon me?
not being teachable.
Excellent. What are some
Sticking,
other barriers?
sticking to your own beliefs.
That's a good
and what
one.
are closed-minded to.
That's a big barrier. Okay, let's talk about our case study. So you have Nancy, she's a public health nurse working in a clinic that provides services to a community of Hmong immigrants. These individuals are applying for immigration visas and are required to undergo medical screening. Primary purpose of conducting these screenings is to determine the presence of any communicable diseases and to vaccinate, according to CDC. Okay, she's typically the first person to initiate contact with the new immigrants. She does not speak the same language as the individuals who report to the clinic, but she has access to an interpreter. She's aware that the clients are nervous about seeking care because they are unfamiliar with U.S. health practices. This is a very common scenario. Very common scenario. All right, so if you're in this scenario, the public health nurse providing service to recent immigrants should most be concerned with which of the following, based on that description of the case study. What did room one come up with? What's the right answer?
We said B.
Okay, right? And based on what we just described in the case study, that's what they're concerned about, right? Being knowledgeable about high-risk diseases of the population, right? So the rationale for this question that we need to know what specific risk factors are there for any given immigrant population. And here's some examples. Southeast Asians are often at risk for hepatitis, TB, intestinal parasites, and visual, hearing, and dental problems, right? And we know most of these, what we just said, conditions are either preventable or treatable if they're managed correctly. I mean, when working with immigrant populations, consider our own background, our own beliefs, our own knowledge. All those values, beliefs, knowledge, practices may be extremely different from those that we're caring for. Another barrier is language, right? Language barriers may interfere with efforts to provide assistance. So the nurses need to understand if cultures also have non-tradition healing practices they would like to be part of their plan of care. Okay. Second question. The nurse, she speaks English and Chinese. She's dealing with the new Hmong immigrants who speak Laotian as their primary language and are unfamiliar with Western medicine. How is cultural competence demonstrated in dealing with this population? Did room two come up with B? Oh, go ahead.
Yeah, we came up with B and E. The nurse
Okay.
provides care while paying attention to individual beliefs about pain, touch, modesty, and eye contact.
Mhm.
And then the nurse provides care that acknowledges the differences in ways individuals respond to illness and treatment.
Yeah, that's exactly right. That's what we've just been talking about. Let's look at the rationale, right? So culturally competent nurses function effectively when caring for clients of other cultures, right? So if you're a culturally competent nurse, you are going to be able to provide competent and effective care, right? We do, as nurses, should be striving to be culturally competent, respecting people from other cultures, and value diversity, right? This all helps in providing responsive and competent care, right? Cultural competence includes acknowledging the fundamental differences in the ways clients and families respond to illnesses and treatment from what might be your response or a more typical response from the Western culture. We talked about some of these examples already. What are their dietary practices? What are their beliefs about pain and pain management? Really important, what are their beliefs about death and dying, end of life care? modesty, eye contact, closeness, and the touching. All these play into cultural competence. This is a good rationale here. So she attends a class at the local Laotian Culture Center so she can learn more about the customs and practices of the community she serves. What does this demonstrate? Which part of cultural competence does this demonstrate? Did room 3 come up with?
Can't wait till you go to jujitsu and go to gymnastics so they can.
We chose D.
We chose D.
We wanna do something.
Okay. Let's talk about the difference between cultural desire, cultural skill, cultural awareness, and cultural knowledge. And this particular question is showing how she is trying to improve her cultural knowledge by attending a local function with this community. All right, so this rationale really breaks down the different parts of cultural competence. Okay, so we know that cultural knowledge is information about a certain culture's makeup. Right, so cultural knowledge is information about organizational elements of diverse cultures and ethnic groups. Okay, the emphasis for cultural knowledge, like she did, is about learning about the client's, the culture's worldview from their perspective. Right, when we have an understanding of our clients' cultures, that decreases the chances of misinterpretation, miscommunication, misapplication. Okay? That's cultural knowledge. Cultural desire, this is your motivation to provide culturally competent care. So you're desiring to learn about a different culture so that you can incorporate those cultural values, beliefs into the plan of care. Right? And then skill, cultural skill. How do we integrate our awareness, what we know about the culture, and our knowledge, right, to meet the healthcare needs of our culturally diverse client? So that's a skill. Okay, and then our awareness. It's that inner taking a look inside ourselves, our in-depth exploration of our own beliefs. Okay, so essentially attaining cultural competence for us as nurses is being able, the overarching goal is to be able to look at that client through their eyes, right? Their perspective. We don't necessarily, that old saying, we want to be treated as others would treat us, but cultures are so vastly different that that really doesn't apply. Right? We don't expect to be treated the same way another culture client may want to be treated. Okay. I really focus on this in week 8, culture, because having cultural competence is one of the foundations for our profession. Would you agree? There's no way of avoiding it. There's no way of getting around it. Plus, it enhances our skills, right? It enhances our awareness of everything around us. So, was that case study helpful? Okay. That's really all I wanted to do today. I got finished a couple of minutes early. Does anybody have any questions? So you've got your exam 3 review. You've got 5 review sessions coming up starting today. If you can attend them, that's fantastic, live. If you can't, I'll be providing you all the recordings as they come in each day from the other instructors, right? So you'll have 5 opportunities for live and you'll have 5 recordings. Okay. So next week, well, let me back up. If after attending reviews, watching the recordings, you get through the weekend and realize next week, Monday or Tuesday, that you need some help with any of the concepts being covered, because there's a lot of concepts being covered on exam 3. It's week 7, 8, and 9. Okay. So no, week 6, 7, and 8. Sorry. There's a lot of concepts being covered. There's a lot of information. If you have done your due diligence and prepared for the exam and find that there's some concepts you're still struggling with, please reach out to me next Monday or Tuesday or Sunday. Shoot me an email and say, hey, I just want to meet briefly and talk about a couple of the concepts. I just need a little bit better understanding. All right. So please reach out to me if you need anything like that. Okay. So next week will be week 9. You'll be in your exam. And then week 10, we still have class. But week 10 is a HESI review. All right. So 2 weeks from today, I'll be spending the class doing a HESI review. So I really encourage you to open up that HESI review, that big booklet I sent you, prior to week 10, because I don't want you to be overwhelmed. I think I talked about this before. It's 50, 60 pages. But the information, the concepts in this big review book we've already covered. Okay. And so week 10, we'll be doing HESI review. And then I will also be sending out a schedule of the other classes, all the other classes that are in week 10, right? So you have to attend this class 2 weeks from today, but you have the opportunity to sit in on any of the other instructors' classes because everybody's doing a HESI review that week in their classes. And I think there's 12 sections. So I know you're busy, but if you can fit in sitting into another instructor's class just to get a different perspective or a different teaching strategy, you're more than welcome to do that on week 10. All right, so I'll send out a master class list of what times these classes are throughout week 10. And then this weekend's announcement, I put together, I call it a roadmap. So this week's announcement will be 4 weeks worth of announcements. I like to do a roadmap at the end of the term. So the roadmap will be, hey, we're in the final stretch. It will be what we do in week 9, week 10, week 11, week 12. Okay, so don't be alarmed when you have a lengthy announcement this upcoming weekend. I just like to put it together for you as we go into the home stretch. Okay. You guys are doing really, really, really well as a class. I'm really, really proud of you. You guys are doing fantastic. So keep up the good work. We are in the home stretch. Okay. Very proud of you. And I mean that, every one of you. You guys are really excelling as a group. I'm a little bit bummed out how quiet you were today, but just means I have to listen to myself talk, which I do, but it is what it is. So, does anybody have any questions? Everybody just laser focused. Is that where we are today? We're laser focused on everything else we have going on, right? Laser focused. You got a lot going on. Everybody working. It's a lot. It is a lot. It is, Tamika. Is everybody working on their vulnerable populations paper? You know, try and get that done and submitted. Move that off the plate.
Is that a
Right?
PowerPoint or is it
It's a
you have to,
PowerPoint.
it's an essay? Okay, yeah, because
It's
that's
a
already
PowerPoint.
PowerPoint.
Yeah, it's
Are we able
7, 8 slides. It gives you what the identified health issue is, what the demographics are. Remember, it's in your community. Don't send me a paper that says the homeless rate in the United States is. Send me a paper that says the homeless rate in Jacksonville, Florida is. The homeless rate in my community is. It's a targeted. It's meant for you to explore a vulnerable population that you have interest in, researching in your community. But Maxwell, it's identify the population, what are the health risks, what resources are available, what are the service gaps or lack of resources? And remember, when you do the lack of resources, right? It specifically, read the rubric. It says, what would help? Primary, secondary, tertiary. Just remember to do a primary, secondary, tertiary slide with that. And then a summary. It's not that hard of assignment, but it is 8% of your grade. Okay, so that's 8% of 20%. So don't anybody blow this assignment off. Okay, you've got to turn this assignment in. All right.
Do you
I
have
already have several people that have turned it in. Go ahead, Alexa.
do you have an example just to make sure we're having everything that we need? Like I know there's like a rubric and everything, but do you have an example of a
I
PowerPoint?
could, I could send a previous students. I'd be happy to do that.
Thank you. I just want to make sure I have everything that needs to be on there.
Yep. And
Are we
really, if you follow the PowerPoint, it's pretty straightforward. Yep, it's pretty straightforward. Of what to identify.
Are we able to send you the rough draft before we submit it?
I'm happy to look at it. You bet. I'm happy to look at it.
Thanks so much.
Yeah, you're welcome. But remember, really remember, this is intended to be a vulnerable population in your zip code. Okay, so as soon as you finish it, submit it, right? Get that off your plate. I know you have a lot of other things to focus on as well, so I'm fully aware of that. So please reach out if you need anything, okay? I'm here to help you as we get into the home stretch. All righty? And you guys are doing fantastic on your CJ Sims. Fantastic. Take the opportunity to learn from your CJ Sims too. Read the rationales, do the remediation. Kind of same with NCLEX. CJ Sims are an excellent addition to this course that really, really hypes up the clinical judgment. Are you enjoying the CJ Sims? Have they been interesting? Yeah, take your time with them. Don't blow through them in a couple of minutes. I mean, you should be spending 15 to 20 minutes on your CJ Sim if you want to get all the learning out of it, which you should be. Right? So, yeah. Okay, well, now I've gone through all the extra time I thought I was going to give you back, but at least we're done on time. So, you guys have a good rest of the week. Reach out if you need anything. You've got your exam review schedule in your announcements. I will send a sample, vulnerable populations. What else am I going to send to you? That's it. I'll send the recording. I'll send you the recording of the class and a sample of vulnerable populations. Plus, I have some resources from last week, from week 7 that I found that I didn't put in the announcement. So I may, when I send you the recording here, I may send you some additional resources, and this is all about prep for exam 3. Okay? All righty. Have a good rest of the week. Good to see everybody.
Bye, thank you.
Bye.
Thank
You're
you,
welcome.
Ms. Marvell.
You're
Thank
welcome.
you.
You're welcome. You're welcome.